Good afternoon, and welcome to a special presentation about coronavirus disease 2019, or COVID-19. Today we're going to answer some common questions about the outbreak. I'm Loretta Lepore, and today I'm representing CDC's Emergency Partners Information Connection, the EPIC team. We have Dr. Jay Butler with us today. Dr. Butler is CDC's Deputy Director for Infectious Diseases. How severe is COVID-19 for the general population?
For most people, we're talking about a mild illness. The vast majority of people will not require an interaction with a healthcare provider or certainly not an admission to the hospital. And particularly for younger people and especially children, the illness may be very mild. So it's one of the challenges in controlling it is that the spread may occur from people who have really minimal symptoms. There's even some evidence that it may spread from people who have no symptoms at all or who have not yet developed the symptoms. So that can be a major challenge. And one of the reasons why social distancing may be the right thing to do right now, because it's easy to say if you're sick, stay home, but it is possible that people who are not yet sick may be able to transmit the virus as well. I think it's safe to assume that if you're sick, you are and have COVID-19, that is the person who is most infectious, but there may be more to it than that.
And there's just so much we still don't know. I mean,
Yes.
As you said, this outbreak has only been 3 months in, and our scientists are still learning so much more about this on a daily basis.
Yes, and this is a new coronavirus. I frequently hear people say, well, coronavirus is not new. And the family of coronaviruses is not new. So oftentimes household disinfectants will say that it deactivates coronavirus. That's correct. But there's several coronaviruses that have been known for years that cause relatively mild symptoms. The other end of the spectrum, there's also the coronaviruses that cause SARS and one that causes Middle East respiratory syndrome, something called MERS. Those are more severe illnesses. So there's a lot that we know about coronaviruses from those diseases, but we're learning a lot because this is a unique coronavirus that we've never seen before. It's also important to recognize there's a whole world of coronaviruses out there that infect other animals. And for instance, if you've ever looked closely at your veterinary bill, you may have seen a charge for coronavirus vaccine. That's actually a vaccine that is for a different type of coronavirus. So there's no evidence that those type of vaccines would provide protection against the COVID-19 virus.
So specifically, speaking of COVID-19, how does this disease spread? How does this particular virus spread?
Well, it appears that the vast majority of infections are transmitted by respiratory droplet. And what I mean by that is that the virus infects the respiratory tract, including the upper respiratory tract. So if I cough or sneeze, the spray that's produced will contain the viruses, and they will fall as they travel away from me. That's why we're 6 feet apart. Maybe this is a good time when the virus between us should drop to the floor, because that's what would happen in real life. But it's also possible that it can survive on surfaces, and there's some laboratory evidence that its survival in the environment is not unlike the SARS virus. So it's also important to be able to clean surfaces with standard household disinfectants, particularly frequently touched surfaces. So that's things like doorknobs and phones and even tabletops, because the virus may be able to survive for a period of minutes, even hours. And that provides opportunity for the hands to become contaminated, and there's where we get to some of the basic recommendations. It's important to wash your hands for at least 20 seconds with soap and water, or use an alcohol-based hand cleaner that contains at least 60% alcohol. It's also important to break the habit of putting your hands to your face, because that is one of the ways, if your hands are contaminated, you can then inoculate yourself with not just COVID-19, but any number of respiratory viruses.
I think we don't think on a daily basis how often we touch our faces. And with this outbreak, you become much more cognizant of that and have to be more cognizant of that. One of the things that I've heard, just anecdotally, the way that people are determining how long to wash their hands is they sing happy birthday twice.
Yes.
And that's a great way to teach children how long they should be washing their hands with soap and water under warm water. So just a little trick for our viewers out there.
Or the alphabet. A colleague in Louisiana said, wash your hands like you're at a crawfish boil and you need to take your contacts out.
Okay, love that one. That's regional. Public transportation, or children that commute to school on public transportation. Should they be doing this at this time, or is there a recommendation that maybe they opt for a different mode of travel?
Yeah, public transportation really is a major challenge, because oftentimes these conveyances can be quite crowded. There's a lot of high-touch surfaces, such as the bars we hang on to when the subway starts or stops. So we certainly are concerned about the risk of transmission in those settings. The most important thing is, again, if you are sick, stay home. because you don't want to be going onto a bus or a subway with a cough and potentially infecting other people. It's also highlighting the important role of business in encouraging teleworking to be able to lighten the load on the public transit system. And then if the load can be lightened enough, that might provide an opportunity for more social distancing aboard the public transportation routes as well. It's important, it's probably good if you can get some of the small pocket-sized hand gel containers. I understand in many parts of the country they're hard to get, but that's a great thing to be able to have to do hand hygiene. If you've been on board a subway, for instance, and holding on to the bar, think about that touch surface and be sure and practice hand hygiene as much as possible. Keep your hand away from your face.
So we've had some guidance this week about mass gatherings as well. And when we talk about mass gatherings, we're referring to things like public events, whether they're sporting events, whether they're conferences, business conferences, all types of events of that nature. There's been new guidance. Can you speak to the new guidance that's come out this week with respect to mass events and also to social gatherings?
Yeah, and the newer guidance is based on some of the observations of how the virus has been transmitted, excuse me, to a relatively large number of people in some settings where people are gathered together. So it may be time that we abandon the term mass gathering, excuse me, and focused instead on gatherings in general. A question that's come up often is, well, how many people should that be? And as you can imagine, that might be really variable depending on the type of event. Here in this room, there's 5 of us. We're the closest of the 5 people who are here. So this is probably a low-risk gathering. On the other hand, if we were sitting next to one another across the front here, that might be a higher risk gathering. So at this point in time, the recommendation is to minimize those gatherings altogether. Gatherings of more than 10 people, I think, have been particularly called out as of concern. And we realize that that's very disruptive because now we've gone beyond just large faith-based gatherings or business conferences, but really we're talking about things like weddings and family gatherings. So it's not easy. Of course, sporting events have been canceled. Live audience TV shows have either gone without audiences or have been canceled altogether. So we do recognize that it's disruptive, but this is an important part of how we at least start social distancing until we know more about how this pandemic is going to progress and what we can do to slow it.
And what are the most significant parts of protective gear for the healthcare community? Right.
So we're talking about things like masks, goggles to protect the eyes, gloves, very broadly. In terms of the COVID-19, one of the particular issues has surrounded masks. Mm-hmm. And there's 2 types of masks, and of course there's more than just 2 because we see them increasingly in the community as well. But from a healthcare standpoint, they're the types of masks that actually filter the air. N95 is a term people have heard quite a bit lately, and that's to prevent inhalation of viruses, particularly airborne viruses. Mm-hmm. And it is possible that we believe that this virus could become airborne in certain hospital situations where aerosols are generated by medical procedures. On the other hand, surgical masks provide more broadly some protection against respiratory droplet type infections, and also sometimes we'll put a surgical mask on someone who is ill with a respiratory illness, if you will, as a splatter shield, so that if they cough or sneeze, those droplets are contained within the mask. So surgical masks have both a protective role for people who are not sick and for people who are sick to prevent spread.
Hello, I'm Dr. Isaac Ginai. I was part of a team that authored an article published on April 8, 2020 in CDC's Morbidity and Mortality Weekly Report, which reveals important new information about how COVID-19 can spread in a community. Large family gatherings can be a way to spread COVID-19 in communities, as illustrated in the cluster of cases detailed in this report. Patient A1.1, the initial patient in this investigation, was part of family cluster A. Patient A1.1 was the first case and represented the first transmission generation. In February 2020, a funeral was held for someone who died of non-COVID-19 causes. A close friend of the family, patient A1.1, shared a meal with members of the bereaved family, family B, the night before the funeral. Patient A1.1 had recently traveled out of state and had mild respiratory symptoms. Patient A1.1 had close contact with members of family B at the funeral. 3 members of family B developed COVID-19 symptoms in the days following the funeral. Patient B2.1 was hospitalized. Patient B3.1 developed symptoms days after embracing patient B2.1 while at the hospital, while not wearing personal protective equipment or PPE. Ultimately, patient B2.1 died on day 28. 3 days after the funeral, A1.1 attended a birthday party with 9 other members of family A. 7 party attendees then developed symptoms of COVID-19. 3 were confirmed to have COVID-19, and 4 others were diagnosed with probable COVID-19. Patients A2.1 and A2.2 were hospitalized and ultimately died. 1 family member and a home care professional developed probable COVID-19 after providing personal care for A2.1 without using PPE. Patient A3.1 likely spread the disease to patient A4.1, a household contact who did not attend the birthday party. 3 birthday party attendees with probable COVID-19 attended church 6 days after developing symptoms. Patient D3.1 developed COVID-19 following close contact with these patients at church. This cluster ultimately resulted in 16 cases and 3 deaths, and highlights how quickly the virus can spread in the community. Staying home and avoiding large gatherings are key to slowing the spread of COVID-19.
Here's a quick workplace safety tip from DOL. Reducing the spread of COVID-19 is a community effort, and hand washing is an important part. Your employees will be safer if customers and visitors have access to hand washing stations too. Soap and running water are best, but if you don't have them, provide hand sanitizer with at least 60% alcohol.
When wearing a mask for work, the following steps can help you correctly put it on and take it off to keep yourself and others safe. First, wash your hands thoroughly and inspect your mask. If it appears damaged, do not use it. After inspecting the mask, cup it in your hand with the nose piece at your fingertips and the straps hanging below your hand. Next, lift the mask under your chin with the nose piece up. The top strap should go over and rest at the top back of your head. If you have a second strap, position the bottom strap around your neck and below your ears. Be sure not to crisscross the straps. If your mask has a metal nose clip, place your fingertips from both hands at the top of the clip. Slide your fingertips down the sides of the metal strip to mold the nose area to the shape of your nose. Now you need to check for a proper seal. Place both hands over the mask and take a quick breath in to check whether the respirator seals tightly to your face. Keep both hands completely over the respirator and exhale. If you feel leakage, there is not a proper seal. If air leaks around your nose, you need to readjust the nose piece. If air leaks at the mask edges, readjust the straps along the sides of your head. Take these steps until you get a proper seal. If you do not have a proper seal after repeating the steps, ask for help or try a different mask. Once your mask is on with a proper seal, do not touch it. Before removing the mask, first thoroughly wash your hands, then reach up and pull the strap over the back of your head without touching the respirator. If your mask has 2 straps, remove the bottom strap first, followed by the top strap. Discard the mask in a waste container and again thoroughly wash your hands. Following these simple steps will help you properly put on and take off your mask and keep you and everyone else safe.